Hi, everyone, and welcome to the very first episode of Talking Public Health, a Shelby County Health Department podcast, where we will take you behind the scenes of our work, highlight the people who make it happen, and have real conversations about health, community, and everything in between. My name is Tyra Moore, and I am the Special Assistant to our Division Director and Health Officer with the Shelby County Health Department.
And I'm Amaya Gray, Marketing Coordinator with the Shelby County Health Department, and we are so excited to be kicking things off today with our Director, Dr. Bruce Randolph, to talk about the vision behind this podcast and the department's goals moving forward. Dr. Randolph has dedicated years of service to improving the health and well-being of Shelby County. As health officer, he aided in leading the health department through the COVID-19 pandemic, strengthening partnerships across government, healthcare, and the community. Following that, he served as Corrections Health Officer and Administrator of Inmate Health Compliance, ensuring quality care for one of our most vulnerable populations. Now, following a brief retirement, Dr. Randolph returns to the Shelby County family as the new Interim Division Director and Health Officer of the Shelby County Health Department. With over 40 years of experience in medicine, public health, and community leadership, we're honored to welcome Dr. Bruce Randolph. Dr. Randolph, thank you so much for being here. This podcast has been a long time coming, and I think it's a great opportunity to connect more with our community.
Yes, welcome.
Well, thank you. It's a pleasure and an honor to be here.
So, before we dive in too deep, let's start with the basics. What inspired the idea for creating a public health podcast for our department?
Well, I feel that we needed a more, should I say, current way of reaching the public.
Mm-hmm.
We're now in a new generation, that say the generation that I grew up in, where social media is second nature. It's the way that young people communicate, from TikTok to Instagram to Facebook, etc. So I feel that in order to get our message out, we need to utilize those various vehicles. Also, there's so much information out in the social media realm in which a lot of it is not accurate, correct. And I think we need to get out there and compete and let people know what the real information, the true information is. And so I think it's time. I'm glad that you all are taking the lead on that. You all are what we call the Joshua generation. It's time to hand the torch over to you all and take the lead. And I think that you all have a better insight in how to reach young people than, say, my generation.
Yeah.
So that's the reason why I felt that we need to move in this direction.
Okay. What are some of the goals or outcomes that you hope the platform will achieve?
Well, one goal is to inform the public, to give them accurate, evidence-based, transparent information that they can use.
Mm-hmm.
I believe that if you give people information that is relevant, that they can understand, that they would apply it to their particular situation, particular life. I think a lot of people don't do because they don't know.
Mm-hmm. Mm-hmm. Yeah, so true. It's one of those things of, if you don't prepare them with the information, how are they to know how to utilize it?
Exactly. And and it's easy to take things for granted. Like some things, I have 3 children, and some things that you will assume that they may have picked up, I guess, through osmosis or whatever, that you think they would know, they do not necessarily know unless I instruct them. And oftentimes they would say, "Well, you never told me that, or you never."
Yeah.
So how was I supposed to know if you never really taught me, right?
Yeah.
And so that's what we want to do, is give people, young and old, information.
Yeah.
Yeah.
To be able to use.
And I think within this is a new chapter for the health department as a whole and how we're aiming towards communicating with the public. So I think it's a great start.
Yeah, for sure. Kind of speaking on that new chapter, for you, as you got here in July of this year, you're familiar with the health department, but this is your first time in the role of division director. So for you, how do you see this new chapter kind of playing out, the vision for the health department?
Vision,
Yes.
yeah. One of the things that happened as a result of the pandemic
Mm-hmm.
and some of the public health measures that we had to take and some of the missed messages that was out there, there's a distrust in public health. There's some people who are very skeptical. And so one of the things that I hope to achieve is to reestablish credibility by being very transparent, and again, by providing applicable science, evidence-based information. And so I would like for us to get back to our basics, in terms of what it is that we do in public health. Our motto is we, prevent, promote, protect.
Mm-hmm.
And so that's what we want to do. We want to really be about preventing illnesses and diseases as much as we can, promoting health and wellness, and protecting people's health and safety. And so we have programs in place that are designed to do that, from environmental health that's designed to protect us in terms of making sure we have good quality air, water, food supply. We have also our infectious disease department, should I say, the clinical health, that pretty much focuses on communicable diseases such as HIV and sexually transmitted diseases, but also any type of outbreaks.
Yeah, kind of like a wide array of things.
A wide array in the population. The truth be known is when you look at what has contributed to the overall health of a society, and even the longevity, it's really the essential functions of public health that's contributed most to that than high-tech, state-of-the-art procedures of medication.
Right. Which are helpful, but it's sometimes harder to understand the more complex the get.
Well, it's helpful for an individual, but when you look at a population, the thing that, put it this way, a good example is prior to vaccinations and antibiotics, people didn't live long. 25, 30, 40 years was old, right? Most people died of some acute infection or something like that.
Yeah. So
with the advent of antibiotics, but more importantly, sanitation, poor sanitation contributed to a lot of deaths. So clean air, clean water, clean food, sanitation, hand washing, all of these public health things that we promote has contributed to a lot to the overall improvement of the health of a population.
Yeah, for sure. Yeah, you talk about like the improvement and kind of like that progression. How do you feel like podcasting can play a role in, reaching that group that we are missing?
Well, you all spend a lot of time on your devices. And so we're hoping that this will grab folks' attention. I know my daughter, matter of fact, I don't think she even watched TV that much.
Okay.
She's constantly, even her news, whatever information she gets is via some podcast.
Yeah. So
You know, and I even have said, I said, now how come you listening to this individual? And they have her attention. So I'm like, well, maybe we can grab some attention around health issues.
Yeah.
And so let's put it out there. Let's compete in the public realm.
Yeah. Really centering on the people and engaging the
Yeah.
groups that we need to.
Yeah.
For sure.
So just about wellness a lot, like wellness tips and mind, body, and soul. So how do you plan on implementing that as a not only a staff-led approach, but also like a community approach?
So the message is we want people to understand that health, according to the World Health Organization, right, is the complete well-being of the individual, socially, really economically, and not just the absence of disease, infirmity, right? So it's more than just health and wellness is more than just, well, I don't have hypertension.
Yeah.
You know, so there's a lot of people may not have hypertension, may not have diabetes, but they're dealing with emotional issues, stress, right? Depression, anxiety, uncertainty. You have folk who may eat and exercise and do all the right things, but they're not content, they're not happy, there's not that inner peace, their spirit is broken, etc. So the philosophy is that in terms of total wellness, is well-being of spirit, mind, and body.
Yeah. And
that you are completely well when they're all in harmony with each other. And I think there's evidence to show that, for example, people who have faith do better in their recovery from surgery, and illness, and what have you. So we're just trying to get people to understand also that they have power. You know, you have the ability to make a difference in spite of the social determinants of health, right? I mean, we can't really control the conditions in which we were born, live, etc.
Right.
But given those conditions, there are things that you can do to help overcome them, to have what we call resilience, which is overcoming hardship, trials, as those folks say in the church, trials and tribulations and whatever. So that's going to be our message, is that, you know, so even when we're talking about HIV, when we're talking about STIs, when we're talking about any of the other health issues, to help them to understand that it's just not taking the antibiotic. It's just not using the condom. It's the combination of things. You know, being in healthy relationships, for example, would be important.
Yeah, and stability. Yeah, I like what you said about power. I feel like a lot of the times, at least with our generation and possibly generations before us, we can feel powerless in a lot of things when it comes to health or just life or the day-to-day, honestly.
Yeah.
And so, yeah, trying to restore that sense of power can be really important for someone's health.
And I want to remind young people, if they study history, it's young people that brings about changes. You know, even when we go back to civil rights movement, it was young people out there protesting. Right? Martin Luther King was 26 when he led the Montgomery bus boycott, for example.
Yeah.
Right? So young people, you know, that's why I'm encouraging y'all to step up, speak out. The other thing you need to realize, there are more young people in our population
Yeah.
than older,
Uh-huh.
right? And so that's why young people need to get involved,
Mhm.
let their voices be known, because they have power.
Yeah, I agree.
Yeah.
How hard do you think it will be to kind of really reel that idea in, though?
Mhm.
Especially given the current climate here in Memphis.
Yeah.
So many things that are going on. I feel like a lot of people are also occupied by other things, but it's not to like diminish that public health and like your health and wellness is still very important to focus on.
Yeah.
Well, and part of that, well, a lot of that is to show the relationship between what's going on in society, okay, social interaction, culture, economics, politics, all of that really is what makes public health what it is.
Yeah.
Public health is really people's health,
Yeah.
which is really policy health,
Mhm.
right? And so to get people to understand that, because when they hear public health, they, some would think of, well, I go to the health department to either get my shot, get my vital records, get treated for STD.
Or a birth certificate.
A birth certificate, right? And there's much more to that. I mean, we do those things.
Right.
But the truth be known, we feel that we are more successful if we can teach you how to not get an STD.
Yeah.
Or STI, as they use. That's, we're there to treat it, but we much prefer you not getting infected. And here are the ways that you can avoid getting infected.
Yeah.
Yeah.
And you kind of touched on it a little bit, and Amaya did too, with the current climate and how we feel kind of going into this as public health professionals, but also the public. So how do you feel that this podcast will be a chance to feature the voices across our department, increase morale, and just, get us talking more about public health?
Yeah, I think, and I'm hoping that this would be an avenue to expose the community to what we have to offer at the health department. Because a lot of people really don't know. I'm amazed when we give tours, whether they're doctors or professionals or lay people, are surprised. Oh, I didn't know you all did all of this. I didn't. They don't. And so we got to spread the good news of public health. We got to preach the gospel of public health and let folk know that no, it's here and it's reliable. You can trust it. In spite of any changes that may be taking place at federal level, still science is science. Truth is truth.
For sure.
So what are you most excited about for the department's future, and including this podcast as we move forward?
I guess most thing that I'm excited about is the, should I say, the motivation, the excitement that the team, when I say team, I'm talking about the staff and the other employees there at Shelby County. I see that there's energy, there's a desire to do things differently. Let's move beyond, well, we've been doing this for 30 years. Well, okay, but this is a new day, a new generation, right?
The new age.
New age. And is that because you've done it 30 years doesn't necessarily mean that's the best way of doing it. There's other ways that we can do things. And so I think that what I'm sensing is that there are a lot of people who have the desire to be innovative,
Mm-hmm.
creative, want to give their input,
Mm-hmm.
and want to be given the opportunity to lead and direct.
Mm-hmm.
And I'm of the opinion, and I guess it may be because of where I am, my stage in life, whereby I see one of my roles is to provide guidance,
Mm-hmm.
counseling, mentorship, and to help educate the next generation. I mean, I've been in this game for over 40 years.
Mm-hmm.
So, you know, I'm sort of, as they say, headed down the mountain, whereas your younger generation are climbing up the mountain.
Hiking, sledding and hiking.
So it's my job to kind of tell you, okay, now when I was climbing the mountain, this is where I stumbled.
Yeah.
So you might want to avoid this particular rock,
Right.
pothole,
Mm-hmm.
or whatever. And so that's where I think my role is in terms of providing that leadership, that guidance.
Yeah. Sure. Well, I know Amaya and I are very excited to be able to speak to a lot of people throughout the health department.
Mm-hmm.
So I feel like every day I learn a new thing of what we do and the depth of what we do.
Mm-hmm.
And so I'm excited for not only us, but more people to know. So I guess, one final question is, what is one message that you hope listeners take away from this first introduction episode?
I think that the message that I would want folk to take away as pertains to our interest in health and wellness, the concept of total wellness, that if they would do the following things to strive to achieve in total wellness.
Mm-hmm.
Have faith, of course, practice the principles, teachings of your faith. Be in meaningful, healthy relationships. Move your body, i.e. exercise, physical activity. Limit the type of foods that you eat. Eat more vegetables, fruits, those types of things. Limit the salt, fat, grease. Manage stress. Learn how to relax. Learn how to meditate. Learn how to pray, dance, music, whatever. But learn how to protect your mental health and enhance your mental health. And then I would say get some rest. Studies have shown the importance of allowing your body and your mind to rest. Put the phone down sometimes. Really start doing some soul searching and reflecting on life, and realize that you are more than what you see in the mirror.
We're bigger than we think.
Yeah.
Very insightful. Well, Dr. Randolph, I just want to thank you for coming and being our first guest on this podcast.
Sure. I'm
Kicking
looking
us
forward
off.
to it. I think it's going to be great.
Yeah, same. I'm really excited to see, all the things we learn and what we can kind of talk through with the public and between internally too.
Yeah.
So to our listeners, thank you for tuning in. Be sure to follow along for more episodes as we continue exploring the people, program, and stories that shape public health here in Shelby County. Until next time, take care and stay healthy.
We want to hear from you. What questions do you have for public health? What topics do you want to hear about? Please let us know by sending us an email at shelbytnhealth@shelbycountytn.gov. Be sure to put podcast in the subject line.